Now, even though it's the leading cause of cancer deaths, the good news is that lung cancer survival rates have increased over the past 5 years, according to the American Lung Association. Joining us now in the studio is Dr. Hussam Ismael, a board-certified consultant surgical oncologist from the American Hospital in Dubai. Thank you for joining us, Doctor.
Thank you for having me.
Of course. Now, first and foremost, can you please introduce lung cancer to our viewers?
Yes, so lung cancer is the leading cause of cancer-related deaths worldwide for both men and women. And it typically develops with some abnormal cells that multiply and grow out of control and create a tumor. There are two main types of lung cancer. There's non-small cell lung cancer and small cell lung cancer, both with unique characteristics and a different treatment strategy for both. Lung cancer is often diagnosed late, and so when it's diagnosed late, we have limited treatment options. Therefore, we emphasize screening for high-risk individuals to be able to pick up the lung cancer early, and then we can go for a cure.
Now, what are some symptoms that a person might, feel like they need to come in for a screening or a checkup?
Almost half the patients have no symptoms at all. They're completely asymptomatic. They go to their medical provider for something unrelated, a headache or back pain, and during the workup, they incidentally identify a shadow in the lung or a lung nodule that requires workup. However, for those patients who do have symptoms, symptoms are usually a persistent cough, sometimes with blood, shortness of breath, wheezing. If the cancer is advanced, chest pain. And then there are a group of constitutional symptoms, so loss of appetite, unexplained weight loss, fatigue, night sweats, low-grade fevers, and so on. So whenever we see those symptoms, the patient needs further workup, obviously.
And then once that happens, how is lung cancer actually diagnosed?
So the diagnosis of lung cancer begins with a full history and a physical examination. And with the history, we ask patients about any respiratory symptoms, family history of lung cancer, smoking history, and then we do a physical exam, and that is followed with some imaging studies. So we typically would do a chest x-ray or a CT scan, which is even better, and that typically identifies something. So if we do find a shadow or a small nodule or mass in the lung, then based on the characteristics of it, it's either something minor that we just monitor with serial images, or if there's suspicion, then we need to work it up further. If we work it up further, we typically need to get a tissue diagnosis, and we do that with a biopsy.
Okay.
There are multiple ways we can get a biopsy. We can get a CT-guided biopsy. That's usually done by the interventional radiologist. The patient's awake, and with local anesthetic on the skin, a needle goes in, targeting the suspicious area, and we get some cells. The other way to do a biopsy is through a bronchoscopy, which is just a very thin, flexible tube with a camera at the end. And we introduce that through the nose or mouth, through the airways, into the area that is of suspicion to get some tissues. And then if we can't do one of those, then the third way we can do a biopsy is surgical. And it gives the highest yield for diagnosis. However, it's the most invasive as well. We have to take the patient to the operating room and take a piece of the lung, including that suspicious area, so a wedge of that area, send it to pathology for examination, and that will give us an answer.
Now, doctor, one question I do have is, can you tell us about the importance of early detection? Just like with many cancers, I know that is important, but why specifically with lung cancer is early detection important?
Early detection is key in the management of lung cancer, because if we identify lung cancer early, we can actually go for a cure, especially stage 1 lung cancer. The other thing is, with early detection, if we identify early lung cancer, then we can preserve more lung tissue. If we intervene and take lung out, we can preserve more lung tissue. Not to mention the cost on the healthcare system. The treatment of early stage lung cancer is not as costly as advanced stage 4 lung cancer. But the most important thing is the prognosis of the patient, identifying something early, giving the best outcome for the patient, and potentially a cure.
Okay, and so we are running out of time, but I do want to ask you this final question. Can you tell us about the latest advancements when it comes to lung cancer treatments?
There are a lot of advancements that have really changed how we look at lung cancer. Some of them include targeted therapy, where we give medications that target specific genetic mutations in the cancer cells. Immunotherapy as well is a big one that has really changed things. When we give immunotherapy to patients, it boosts their own immune system to fight the cancer. There are advances in radiation oncology and advances in surgery where we're doing more minimally invasive techniques, robotic techniques, which we do at the American Hospital, and also taking less lung tissue with and providing the same long-term disease-free survival. So we're basically, with the surgical thing, since it's the last question, we're doing more minimally invasive stuff, robotic techniques, and taking less lung tissue, which improves the quality of the patient's life.
Thank you for your time with us, doctor. A very important topic that you discussed with us here today. Best of luck.
Thank you so much.
Thank you.